All right, for more on the launch, we're joined by the Director General of the Department of Science, Technology and Innovation, Dr. Mlungisi Cele. Dr. Cele, very good evening to you. Thank you so much for joining us. Welcome to the late edition.
No, thank you very much, Simpiwe. Good evening to you and your listeners.
First of all, congratulations on the launch of CATIR. But could you first unpack the specific gaps or the strategic needs in South Africa's research and innovation system that this center is intended to address?
Well, no, thank you very much. It's important to underscore the point that access to healthcare is a global issue. And when faced with a pandemic, the implications and challenges of working in resource-constrained environments are evident. Simpiwe, you'll remember that during COVID-19 pandemic, vast inequalities that exist, within the African continent were highlighted, and we also have a number of marginalized communities, which are often at higher risk as they lack the necessary expertise or appropriately trained human resources to address, healthcare requirements. So what, for instance, the African countries have done during COVID was through local investment and access to global funding, invested in infrastructure to address clinical and molecular requirements. However, there are still gaps in respect of expertise and knowledge transfer throughout the continent. And the value of education and training remains crucial to ensure appropriate knowledge interchange and transfer. So, it is in this context, therefore, that the partnership which you have characterized between our department, the South African Medical Council, as well as Thermo Fisher Scientific, will play a critical role in terms of training and research in molecular biology and life sciences,
And having said and having said that, why was molecular science and laboratory management chosen as the focus areas for CATIR, and how do these disciplines align with South Africa's broader innovation and development goals?
Yeah, you see, for instance, our national decadal plan for science, technology, and innovation has identified health innovation as one of its top priorities, which government has now embraced, right? So, and part of this center, of course, or the essence of this center is to make sure that it enhances training and skills development in these areas that we have identified. It will also help us to equip future scientists with the state-of-the-art resources and hands-on experience. This program has been implemented in the Western Cape, so let's make that point. So today we were launching it in Pretoria so that people or young people from Limpopo, Mpumalanga, KZN, Northwest would not need to go to Cape Town to access this kind of training. And the employment rate is actually quite high, over 60% of young people who have done internship through this kind of training are easily absorbed. So the program enhances the employability of graduates. So that's a key consideration as well.
Yeah, and perhaps another sticking point is access, like you've alluded to, access and accessibility, and how will CATIR's work practically translate into stronger health system resilience on the ground, particularly in the under-resourced provinces?
Yeah, it's important. You and I will also, and your listeners will appreciate that if we're able to reach young people living in the most remote rural areas, encourage them, create this kind of a possibility of them to get this type of training and therefore be able to get employed. In turn, they will be able to support their families and also help us, especially the challenges in the healthcare sector, in the hospitals, and also in the research system as such, because we also need people who can pursue research interest in the various areas that are crucial. For instance, this center, we were, they were indicating to us that learners will be, or students will also be exposed to the kind of facilities that could enable them when they have to do serious research on cancer, that they would have been exposed to the basics, so that they don't struggle to do advanced research in areas like cancer, HIV, and so forth.
Dr. Cele, it's quite interesting that you say that, because South Africa continues to face a shortage of high-level scientific skills. So what specific training programs will this CATIR program offer to address these gaps, and who will be the primary beneficiaries?
Well, as I indicated, the primary beneficiaries are young people from townships, from rural areas in the provinces that I've mentioned, Limpopo, Mpumalanga, Northwest, KZN, and even here in Gauteng. So we essentially, for instance, the University of Venda participated in the event because they also training quite a number of young people who need this kind of exposure, because this is really a laboratory that will give those who might have not been exposed in terms of the laboratory skills, in the way that because this center will have the state-of-the-art equipment and consumables, and also the kind of supervisors who will be there will really help them to soften their skills. But it's not just hard skills that they'll be exposed to. Even soft skills that are necessary to advance their science careers will also be exposed. So basically, they will be exposed to how to operate in a laboratory, how to manage labs, and also other capabilities, but also theoretical science, building capabilities in bioinformatics, and other practical applications will be offered.
All right, Dr. Cele, great chatting to you. We certainly hope that this center's capacity building initiatives are very inclusive. Thank you so much for joining us.
Thank you very much, Simpion.
Well, the Director General of the Department of Science, Technology and Innovation, Dr. Mlungisi Cele, there talking to us about South Africa's research and innovation capacity receiving another boost today after the launch of the Center for Advanced Training in Innovative Research in Pretoria. And perhaps one of CATIR's goals is to strengthen pandemic preparedness.